intsholongwane kodwa bathe gqolo benikezela ngenkonzo zempilo kuluntu lwakuthi. The little we can do in our households as people of this province is to act responsible, to protect ourselves against this virus, not to expose our healthcare workers to the virus unnecessarily. We collaborated as community to fight this pandemic. We have collectively succeeded in reducing the number of new infections. We decreased the number of deaths, and we reduced the number of cases at our hospitals. We changed our behavior and avoided large crowds and practiced social distancing. Most importantly, we adhered to lockdown measures and adopted the non-pharmaceutical health protocols of wearing masks and washing or sanitizing our hands regularly. As a community, we were able to flatten the curve of this pandemic. Through our joint action, we have saved lives and protected our livelihood. Throughout our fight against this pandemic, the non-pharmaceutical measures have proven to be our solid wall of protection to prevent the rampant spread of the virus. It is our considered view that half the battle against this virus will be won when all of us wear our masks, wash our hands, maintain social distance, and most definitely when we avoid congregating in large numbers. We must all be loyal to these non-pharmaceutical protocols so that we can live past this COVID-19 nightmare. There have been developments over the past 2 months in our fight against the COVID-19. A week ago, the president of our country, President Cyril Ramaphosa, announced that the country was moving to alert level 2, following worrying trends of a resurgence in the Northern Cape, Free State, Gauteng, Western Cape, and KZN. We are a province that shares borders with some of these provinces, particularly the Western Cape, Free State, KZN, as well as Northern Cape, actually. When these provinces sneeze, we also catch the cold. In the past 7 days, there has been a 59.6% increase in active cases from 821 on the 29th of May to 1,310 on the 5th of June. We have observed a rapid rise of active cases in Nelson Mandela Metro, followed by Sarah and Buffalo City Metro. We are closely monitoring incidences of transmission in local municipality areas such as East London in Buffalo City, Ingoba Yathemba in Christiani, Walter Sisulu in Jogabi, Beas Node, Kouga, Ndlambe, and Sundays River, all of them from Sarah Batman. Our teams are on the ground providing heightened case detection, contact tracing, and offering case management, isolation, and quarantine of contacts, as well as index cases. In the past 24 hours, 44 new cases have been recorded in our province, and unfortunately we lost one more life, which takes our death toll to 11,673. The number of COVID patients admitted in our hospital is 139, 95 being in the private hospitals and 44 in the public sector facilities. Amongst the admitted patients, 106 patients are admitted in the general wards, 26 patients are in the ICU, 18 patients are on oxygen, and 16 patients are on ventilation. Sicela ke abantu bakuthi kwiphondo lonke bancedisane nathi, banxibe izifonyo zabo, baqaqelane, baqinisekise into kokuba siyalilwisa olu tshaba lwale ntsholongwane. Ulonwabo lona alubaleki, zonke izinto zawuphinde zilunge. Okwangoku nje ingxaki esijongene nayo ukukhusela ubomi babantu nokubuyisela ubomi babantu bakuthi kwimeko efanelekileyo. Gatherings such as parties and funerals remain super spreader events. Hence, the government is limiting the number of people allowed to attend such events. Imingcwabo ke usukela kulamsinga wokuqala ukuza kumsinga wesibini, umsinga osibonise kakubi kakhulu bulaleni abantu bakuthi apha ephondweni. Sibonile ke into kokuba enye yezo zinto ebezibangela into abantu bakuthi bachaphazeleke imingcwabo, imicimbi, iziyunguma neziyolo. Siyabacela ke abantu bakuthi into kokuba bayazi into kokuba zonke ezi zinto azigqithi. Imingcwabo ke yona funeka iattendwe lela nani liqingqiweyo. Silungiselela into yoba kube lula ukulandela abantu xa kunokuthi kanti kubekho umuntu ochaphazelekayo okulaa mngcwabo yile ntsholongwane osulela abanye abantu. Siyacela ke nenkonzo, ndibonile ndihamba ngapha emampondweni, ndibona abantu ababheke ezinkonzweni besezimotweni, uninzi lwabo ndibona bengenazo iimasks ingabantu abadala. Loo nto ke yenza ixhala kakhulu ke leyo ukuba asinawukwazi uyihlonipha le ntsholongwane sawenzakala, sishiyeke namakhaya ayojongwa ngabantwana. The South African Modelling Consortium estimates that the third wave can be expected in our province from the 14th June and 17th July 2021 onwards, although the peak of the third wave is currently expected to be lower than the second wave peak. Bathi kaba bantu base-Eastern Cape, uvuthondaba lokosuleleka kwabantu namanani ayawuthi abaphezulu alindeleke kule nyanga sikuyo yesilimela. Siyacela ke abantu bakuthi bazame ukuncathama kule migaqo imiselweyo. Alikho ichiza elinyanga lentsholongwane. Zonke ezinzame sizenzayo, noba sithetha ngesifonyo, sithetha ngokuhlanjwa kwezandla, kusanitayizwe, kubhekelelwane, abantu abadala bahlale ezindlini, sizama ukuthibaza amandla nokusulelana kwabantu ngale ntsholongwane. Siyabacela ke abantu bakuthi bayazi loo nto, noba siyabagonya. Ukubagonya oku akuthethi ukuthi liyeza nechiza lale ntsholongwane. Siyabacela abantu abadala ungakumbi bahlale ezindlini, bazame ukuzikhwebula kwizinto ezawuthi zibeke ubomi babo esichengeni phantsi kwale ntsholongwane. Kodwa our people should not panic. They must play their part again, which is adhering to these non-pharmaceutical protocols and COVID-19 regulations. We've used the 2-month lull in new infections between March and the end of May to fine-tune our resurgence management plan to contain the third wave effect. We have identified 8 critical focus areas for resurgence management, and these are the enhancement of coordination, of communication, the strengthening of epi-surveillance response, enforcement of environmental health control and public health strategies, scaling up risk-related communication and community engagement, heightening infection prevention and control, and adherence occupational health and safety protocols, implementation of measures to assess facility readiness and improved protocols for case management, ensuring adequate medical supplies, availability of PPE, and improved logistics of drug supplies and essential commodities, and invested to improve human resource management and support. In line with this resurgence management plan, we can assure the people of our province that we are in a strong position in ensuring bed availability, PPE supply, availability of medicine, provision of essential equipment and measures, track and monitor of resurgence indicators. We are also at an increased level of stability on the oxygen availability, on support to EMS staffing, government-owned quarantine sites, the use of community health and stringent measures for infection prevention and control. The areas of high risk in our resurgence plans are the availability of reliable ICT connectivity in health facilities and budget constraints and finance due to the medical legal claims against the department. To support the implementation of our resurgence management plan, we have made the following interventions. One, we are declaring Nelson Mandela Metro as a hotspot or a high-risk zone. In this regard, we have directed the Director General to deploy a cross-functional team to provide intense support for 14 days in the Nelson Mandela Metro to strengthen stringent enforcement of Level 2 non-pharmaceutical intervention measures. The team will provide support to enhance the preparedness and response to the Department of Health to mitigate the impact of the third wave at hospitals and clinics in the Nelson Mandela and Sarah Baartman district. The cross-functional team will technically support, collaborate, and participate at the Metro JOC, provide support to local community structures on behalf of the PDOC. Secondly, we are strengthening the functioning of the Occupational Health Safety Committee and Infection Prevention Control to secure the availability of PPE, COVID beds, oxygen supplies, and provision of critical care equipment, and the training of clinical staff to manage COVID-19 patients. This team will also activate the targeted track, tracing, and testing, and supportive isolation of index cases and quarantine contacts targeting areas of new infection outbreaks. The team will work with the local communities to provide support to persons in quarantine and isolation and ensure they practice strict adherence to non-pharmaceutical interventions. It will also support the hospitals to optimize human resource availability, liaise with the Department of Health to solve bottlenecks and recruitment and resourcing of the health care facilities. Thirdly, we are ensuring heightened support for mass vaccination. The target of this support is the elderly, persons with comorbidity, the persons in old age and aggregate settings. We will work with the business sector, social partners, and community leadership to support the preparation of vaccination sites at workplace, business, community facilities, and the halls. Fourthly, we are activating support to the local government and community leadership for safe circumcision. As you know that we are once again in this initiation season. As you all know, this month, the month of June, and this is a difficult period. Again, it happens coincidentally together with this resurgence that we are experiencing from this COVID-19. We are anticipating an increase in the number of boys who will undergo the rite of passage in Nelson Mandela Metro and Sarah Baartman during the rite. As we know that the Nelson Mandela and Sarah Baartman were actually prohibited not to perform this practice in the last summer season. We have shared responsibility with traditional leaders, parents, families, and communities at large to join hands and ensure that our boys come back safe as young men. To ensure an incident-free winter circumcision season, we must collectively follow the mitigation measures that have been put in place by government and stakeholders such as medical and COVID-19 screening for boys, strict adherence to COVID-19 protocols, phaya emathondweni okanye emabhumeni, vaccination of amakhankatha neengcibi, enhancement of education campaigns with a particular focus on parental responsibility, law enforcement to enforce COVID-19 regulations and prevention of illegal initiation schools. The last message we want to communicate to all the parents who are sending their children to the mountain this month is that imigidi are not permitted. Sithi noba abantwana sithi maboluke kuba sisazi uxinezelelo esikulo nabazali nabantwana abafuna ukuya esuthwini, mabasiwe abantwana phantsi kwale miqathango elushica ebekweyo. Sicela uba abazali bayazi into kokuba ulwaluko luxanduva lamakhaya, iinkosi zincedisa amakhaya. Masahlukane nale nto sithi ulwaluko luxanduva lweenkosi. Ukwalusa abantwana luxanduva lekhaya. Ootata, oomalume, oobhuti mabajonge abantwana bakwamakwabo xa bebheka esuthwini, baqinisekise into kokuba phaya emabhumeni le miqathango imiselweyo iyalandelwa kangangoko. Kungabikho umntu othi hayi umntanam usebakhwetheni ngoko ke inkosi iyakwenza ngenceba. Sicela abantu baqinisekise into kokuba ubomi babantwana buyajongwa. Abantwana abahlukunyezwa ebakhwetheni, ezaa zinto zomane sinikwa iingxelo zoba kubethwa abantwana ebakhwetheni zizinto ezingekho mthethweni ezingafanelekanga. Xa sisabantwana phaya ebakhwetheni siyokulungisa ikamva labo, siyobenza abantu abafanelekileyo, siyotshintsha nezimilo zabo. Mabangaboyiki abantwana bezi zilwanyana ngenxa yendlela abaphethwe ngayo ebakhwetheni, ngabo banikwe uxanduva lokubagada nokubajonga. The fifth intervention we are making is to intensify communication with media, houses and local radios on the issues related to vaccination, COVID-19 resurgence response, registration and safety issues related to circumcision. We believe that these 5 interventions will stand us in good stead during this third wave. Let me now turn our attention to the vaccination program because it is a critical element of preventing new infections and deaths. Our goal with the vaccination program is to vaccinate all eligible groups, prevent the resurgence of the third wave by enforcing the non-pharmaceutical intervention measures, rapidly scale capacity of vaccination of the most at-risk population, strengthen the epidemic surveillance systems to monitor and track the epidemic, and community and social partnership mobilization for effective vaccination rollout. The protection of healthcare workers through the Sisonke program was a strategic intervention to ensure that frontline workers are protected from the virus, because we will need them to care for the admitted patients. After the completion of the Sisonke program, we started the phase 2 on the 17th of May. This phase is targeting the elderly of 60 years of age and above. The first important step to access a vaccine in this phase is registration. As of yesterday, we had 356,000 older people registered on the system in our province, and the number is increasing daily. We have the 4th highest number of the registered people in the country after Gauteng, KZN and Western Cape. Our concern is that most of the registered older people are in the 2 metros. Most of our elderly citizens reside in the rural areas, and we have directed our stakeholders at a local level to assist the elderly to register in villages and farms. Nevertheless, we have thus far vaccinated 133,000 people in our province. A further 57,000 health care workers were vaccinated with the J&J vaccine at the end of the Sisonke program. I must hasten to add that we have received rave reviews from our older people about the vaccine. There have been far fewer complaints about headaches, rash, fever, pain, and swelling in the vaccine areas. Many older people have told us that our healthcare workers informed them to expect minor side effects. In essence, the older people are happy to receive their jab finally. The number of vaccinated people is undoubtedly going to increase as we received 76,000 doses from a Pfizer vaccine in the past week, and with another 76,000 expected to arrive this week. We have increased vaccination sites from 19 in the first week to 25 in the second week. Week 3 signals the intensification of our vaccination program, and the focus of our vaccination will be mainly in rural areas. We are establishing 114 primary distribution sites and 1,000 vaccination sites for this purpose. Thank you very much.
Thank you very much, Honorable Premier, for that address. I'll now afford the opportunity to the members of the media. You introduce yourself and your media house, and you then ask your questions. Any takers?
No, just a request, if there aren't any other people who want to ask the Premier.
Just hold on.
If we can get a one-on-one with the Premier on the side, that would be much better than if there aren't other people who want to speak.
Thank you very much.
Any further takers? Short and sweet, but will allow the opportunity for the media to have one-on-ones with the Honorable Premier. We'll hold it up. So without much ado, let me thank everybody for coming. We have also HODs from COGTA, HOD from education, officials from health, and officials from the COGTA and the Office of the Premier. They are here. Thank you very much, colleagues. Thank you very much, Honorable Premier DG, for your presence. So without much ado, let me adjourn the session and allow for the members of the media to interact with the Premier on one-on-one. Nimfuna ndani uPremier nto zakuthi ubuchule ilenda inala.
We come out of that briefing, Eastern Cape Premier Oscar Mabuyane giving latest data in the fight against COVID-19, also outlining 8 critical areas for responses in what he calls a resurgence management plan. This includes scaling up risk-related information and the communication of this information and the implementation of required responses. Nelson Mandela Metro identified as a high-risk area and more resources will be deployed there. The initiation season is a difficult time for the province, he says, as it comes at the same time as the resurgence of COVID-19 in the province, and government wants to ensure an incident-free circumcision season. Imigidi are not permitted in this season. 11,673, the provincial death toll. The Premier pleading that ulonwabo alubalegi, there's always another time to have fun. Gatherings such as parties and funerals remain super spreader events, reiterating for the use of non-pharmaceutical interventions, including the wearing of masks. Predictions are that the winter and particularly this cold month will result in an increased rate of infections, so people should be super vigilant. Premier Mabuyane also went into the latest vaccination stats. The province has the 4th highest numbers in the country, 133,000 people vaccinated, excluding health workers. I don't know, is that enough in a province of 6.5 million people? Let us know at the agenda _SABC. Let's